a woman carrying a pregnancy is a risky adventure. But somehow, because many women just go through it without complications or any sophisticated care, we've trivialized it. Unfortunately, for that one woman who dies from the complications of childbirth, it's 100% to our family and to the society. And we need to start taking it as such.
Yeah. I mean, I just feel like, why should a woman die because she's pregnant and she wants to give birth?
Yeah, even with the best of care, things can happen. Complications can arise beyond medical control. But it would have been said that the best, had been given to that particular woman. You have given your best in terms of available equipment, skills, services, and the likes.
Yeah, but what I mean is pregnancy is pregnancy a disease? Pregnancy
itself is not a disease, but of course there are things that can go wrong in pregnancy. So I had a safe delivery. It's a retrospective diagnosis.
Yeah, so the reason why I'm asking, the reason why I'm making that statement is, if someone is sick, and the person there are complications of the sickness, person has surgery and dies, the person was sick, but it's different from the person was in the process of bringing to life something that will make everybody happy.
It's the most dangerous thing ever. Because of the demand it places on the woman physiologically. For example, now people just jokingly say that, do goats have anybody attending to them, or dogs have any attendants when they are delivering their own baby? Are human beings goats? Are human beings, but irrespective of the fact that most deliveries will go without any complications from beginning to the end, whether they sought care or not, does not mean that the number of people who would experience complications from childbirth and one life lost is 100%. Yeah. That's the whole point. So the fact that many people don't have issues does not mean we should just take things for granted. And that is why there are skills involved in this thing, in early identification of, there's a chance that this woman is going to have issues. So we are able to categorize women into low risk, intermediate risk, or high risk.
In the past week, and it's been a frequent occurrence that I see lots of complications from childbirth. I see people that die. I see lots of strange complications, and I ask myself, in 2026, in Nigeria in 2026, and I'm not in a faraway village, I'm not in a one remote place, so you can imagine what might be happening in remote areas. So why is it that we are still having these kinds of complications? Is it because nobody just cares? Is it because there's a lot of poverty?
There are so many factors particularly in our climate. So many factors. There's the patient factor. There's the hospital factor, the people that are attending to patients. There's the hospital factor. There's the political factor.
There's the
religious factor. That all of them, when we look at a problem, we need to look at the system, the social determinants or the root causes of those things. So if we focus on the root causes, we are likely to tackle that problem. Because a woman who carries herself to unskilled to a place where there's no skill to manage her, there are many things involved. You see that she may know that this place is not there are no skilled practitioners here, but she may not have the money to go to to a place where she knows that the skill is there. The money may be a factor there. Some people don't even know. I've met people who went to certain places. You can imagine a lawyer going to a certain place, or someone who is when you are conversing with them, you see that this person is cerebral. And they seem not to know that the place that they went to is not a hospital, so to say, and they had mortalities or morbidities in such places. So there are a number of factors. Then we talk about the religious factor, faith-based stuff. Oh, okay, I want to deliver like the Hebrew women. Even before the skilled birth attendants came, they delivered. So there's all those factors, and then the political will to ensure that there are policies, laws that guide maternal services, and to ensure that those things are implemented and followed. Those things are also there. All those things need to be looked into.
Now, what I want us to do is I want to make it practical. So we're going to just examine some examples and then see where people can learn. But one thing I notice is that people don't talk about the problems. Now, if there's kidnapping somewhere, everybody will start shouting, "Oh, they are kidnapping here." If there's a bomb blast somewhere, everybody shouts. They will raise alarms. But when it comes to childbirth, when a woman dies, nobody's going to raise alarm. Nobody's going to say, I've seen this thing happen a number of times. This was why it happened. Please avoid it. Everybody will just keep quiet. And then every other person continues to make that same mistake
again and again and again. And then people find out that people who have
people are afraid. They are afraid that, if I say this, hope they will not come out. Like even this video now, it'd be like, hope I won't step on any toes.
Right? And these are lives of people that are at risk. The issue there is that these unskilled individuals or group of people are so bold. And when they are talking with all, we will do it. You can do it. We can. Well, people tend to believe them because of how bold they have, confidence with which they are overconfident. And when there's a problem, I don't know why. These people never go back to such people. To go and fight them. They don't blame them. Now, when they are saying that this person oti yiwo, let me use the Yoruba, oti yiwo, they will now quickly send to the hospital. Now the patient dies in the hospital. People will now start blaming the hospital. Now, where the patient came from, people forget. They won't blame them. They won't do anything about them, and the cycle just continues like that, putting lives of human beings at risk.
You will see that a particular hospital will have a bad name. And it's not of their own making. It's as a result of
the cases that they are sending to them. So why don't we retrace it back? Where are these cases coming from? All these bad cases that are coming to a particular facility that is giving the facility a bad name, where are they coming from? How can we stop this problem? This is a challenge to each and every one of us. We need to do something. It's not just about lives are being lost, and it looks to me like we can't be blaming the government. We can't be blaming when at our local level we cannot do something about something glaring. It's glaring, and we'll not be blaming the government. The government will not come and do this one for us.
So, a typical example: you see a woman, a young woman. Somebody that is quite educated, someone who has at least gone to the university, has a degree, is pregnant and just feels like, this other person went to this place to deliver and everything went well. And then the person goes there. Now, the starting point, like I always say, the starting point is not even that the person has gone there. There are many problems. One of the problems is the personnel in that facility. Have you asked who are the personnel in this
Exactly, hospital? You need to ask.
Is there a doctor? Is there not just a doctor? Is there a guy, an obstetrician that is taking responsibility for me?
Exactly.
So a woman goes to the place, she's in labor, she develops complications. somebody who is managing her in those places is poorly trained, poorly skilled. They don't know how to. They in fact, they know that there are complications that have set in, but despite that,
they keep
the patient
until near death,
until the patient is just about to die.
And
now,
send.
Why would you send the patient who is about to die out of the hospital? So what's the point? There's no point if the patient is already about to die.
So are you saying that you could not pick those complications earlier? You know, those things are not fair. And the alarming thing to me is that many of the people that do this practice, when their own relations or their own family members,
their own family members
you will not sleep. You will not sleep. They know how to give the best to their own family. It is unfair. And I'm saying this again, that may our consciences not be seared, okay? Because it's unfair.
Yeah, so we've said a lot already. I mean, the message is already passed. Anytime when you check the news, you see stories of hospitals where something has happened, the mother has died, and then they go and close down the hospital. Do you know the number of people that die in places that are not hospitals?
They are not hospitals.
And nobody is saying anything. You don't hear anybody shutting down any place.
So please shine your eye very well. If you go to a facility, ask them, what's your qualification? Are you medically trained? Trained is different from medically trained. The nurses there, are they medically trained? The doctors there, in quote, are they medical doctors? Because we have so many doctors these days. It's not even about having such, because the medically trained personnel, there are not many, even with the Japa syndrome. But there must be a way for these people to be trained, have early warning signs for complications, so that they can send to the appropriate facilities early. Please don't go beyond your limitation. You are not don't try to prove points with people's lives, okay? Because that one life is once and for all, and once that life is lost, it is lost 100% to, you don't know the number of generations that is going to affect. So don't stop proving a point. There's no proving a point with someone's life, okay?
All right, so what we have said in essence is that everywhere in the world, some women will die from pregnancy-related complications,
whether you give them the best or not.
So, but those cases should be few and far between. For example, if you say that, in the last 3 years, we had that there was one case that this happened, then I mean, we know, but no, it's not a situation where every
repeatedly,
month, every 2
consistently,
months, every 3 months, you see those kind of things.
and glaringly, it's there.
Don't keep quiet. Don't be afraid of what anybody will say about you. When you have people close to you, give them the right advice. Don't just say, just go anywhere. No, give them the right advice and give them right on time. There are good facilities, even there are good places where you have trained workers who don't keep pregnant women unnecessarily. Pregnant women who are these workers are trained to detect problems very fast and send the patients away. Those are the places that you should look out for. Make sure when you hear that, a woman dies, find out where did the labor start, where was the antenatal, what are the details of what happened. Don't just say, the patient died in that hospital. No. That will help you to save lives.
At the end of the day, it will help you to decide. At the end of the day, it's your life. You must guard it by all means, and I prayed that God will preserve all of our lives in Jesus' name. Amen. See you next time. Harmonics here.